Nobody knows what's wrong with them, or they told them it's this, but they can't stand up and they don't really know. We'll do whatever it takes as long as it's safe, right? Inside the box, outside the box, whatever. And that's what I teach in there, you know? It hurts when you do that, and then you're going to do that as a treatment, you know? And when you do that as a treatment, you are just basically giving them the slump test, which hurt. If you do not tell a patient that when you treat a frozen shoulder that it's going to hurt, then they don't understand what's happening, you know, and then they're pissed off at you. And then when they're pissed off at you, then they say, this person hurt me, whatever. She had to put her dog down. And that's stressful, obviously. And she had the dog for 15 years. And she went into a back spasm from stress. But I had warned her in the beginning that as part of SI rehab, there is a percentage of people, smaller, but a percentage, that go into a back spasm. Yo, everybody, what's up? Physical therapist, Dr. Whelton, coming to you from just outside the beautiful Tampa Bay area. If you're new to following me, I've got a clinic where majority of my patients, I would say, come in and they list all these things they've tried. I've tried physical therapy, chiropractic, injection, surgery, you name it. You know, that kind of thing, right? Those type of clinics. And a chronic pain clinic. And nobody knows what's wrong with them, or they told them it's this, but they can't stand up and they don't really know, you know? And I've learned to get exceptional results over the years with this patient population. The kicker is I developed protocols to treat these issues. So I've published a lot of them. There you can find it on my website, Whelton methods.com, wheltonmethods.com. And I also have all my courses, which are online. So I have my myofascial courses, which are actually these, I published a paper on these reflex pain points in the body, stimulate one area of the body at a certain joint angle and angle of pressure, relieves pain in another area of the body that I describe in that paper. And that is wildly successful. I have an introductory shoulder money back guarantee course. If you can't relieve the pain, the majority of people you attempt the method on, you get a full refund, no questions asked. I've had that for almost a decade and people love it. So anyways, there's that. I got my rehab results course, which is my protocols that I use, my orthopedic protocols. Like, here's what I do. Okay, here's how I diagnose this issue, and here's how I treat it. And then I also have my sciatica cervical radiculopathy course, which is similar to what I described in the myofascial courses. Different mechanism, but similar. And then I have this membership now. So I am teaching live, and in my membership, in my school group, SKOOL, school.com, you can register on my website. Go to my website, and one of the groups is free. And I teach live in there with live Q&A on how to diagnose and treat. Go to wheltonmethods.com, WHELTON methods.com. And go to the drop-down menu and click Become a VIP member. And it takes you to a page. Just ask for your info. Boom, you're in the free group. And you also get massive discounts on my courses, depending on like what tier, all that stuff. So it's really cool. Anyways, and you can join an amazing community of people that are just like you in terms of like, you know, it's not a job for them. It's more of their purpose in life type thing. So, you know, like this is something that, you know, we need to know how to help, you know, Mr. Smith or Mr. Jones, you know, like we'll do whatever it takes as long as it's safe, right? Inside the box, outside the box, whatever. And that's what I teach in there, you know? So anyways, you can join that. So today I am talking about nerve gliding and why I almost refuse to do nerve gliding except for rarer cases, okay? Now, what is nerve gliding? Nerve gliding in the arm, you got the ulnar nerve, right? Doing that, right? You got the radial nerve, like that, and then the median nerve, okay? And those are the three main nerve gliding that people do in the arm. Now, nerve gliding is, if you ask me, done way too much. So in this clinic where I have chronic pain patients that just threw their hands up in the air at the medical system, don't trust it anymore, not interested, and then they finally, you know, they come in here and they're like, I gave up going to doctors, but I keep seeing you, so here I am. Can you help? And the thing that I hear a lot that they did at their last physical therapist was like nerve gliding type things. But here is my rationale as to why that is not good to do with patients. Okay, ready? So the slump test. What is the slump test? So a slump test is you go like this, slump down, and if they have pain in their back or their leg, nerve tension, then it's indicative of like a herniated disc in your back, pinched nerve in your back, right? Now, I've done a video before. You can follow me on Spotify, Apple Podcasts, YouTube, Whelton methods. And I've done a video before that a lot of times they say my back hurts, but they're actually pointing to their SI joint. And if you use my SI joint diagnostic method, then you should see what I see in here, which is that it was actually SI joint. You just open up their SI joint and then do the same test again. It doesn't hurt. So you can't just say that the person has back pain. You have to ask them where it hurts. Because if they're pointing to their SI joint, then think about what you're doing. It's out of alignment. You're just shearing it bone on bone, right? So the slump test in its truest sense is to put tension on the sciatic nerve, which if you have a peripheral nerve lesion in your lumbar spine, then that bothers it, right? Now, I don't work with too many people. I don't work with anybody. I work by myself, for myself. But I used to see when I did work with people that people would do the, nerve gliding, have them lay on their back and do all this stuff with them, right? Now, why I disagree with that in most cases is because what did I just say? I just said that if you think about it, that if you put tension on the sciatic nerve and they have a herniated disc and it hurts, then the person that's a positive sign for a herniated disc, right? Or a pinched nerve in the back, right? So if it hurts when you do that, and then you're going to do that as a treatment, and when you do that as a treatment, you are just basically giving them the slump test, which hurt them, right? And then therefore you are creating pain. You're creating a problem. And I see these people after, and they're like, man, that flared me up when I went to this PT or that PT or whatever. And I'm like, yeah, that really shouldn't be done, on a case like yours, okay? Now, I am not talking about like a baseball player, in baseball, a lot of them have nerve gliding done by the athletic trainer or the physical therapist before. Great, good for you. You should do that if it makes your arm feel looser, right? I'm talking about people with herniated discs, okay? And people with herniated discs you are irritating it by stretching, putting tension on that nerve, okay? So there was one patient I saw years ago that, well, let me back up and say this, is that in this clinic, this chronic pain clinic, where people just throw their hands up in the air at the medical system, I've been to this prestigious hospital, that prestigious hospital, and I get exceptional results. And I can usually get my patients out of pain immediately with my methods. And people that are doing my methods all over the world message me and they're like, dude, this is crazy. I can't believe I'm getting all these people out of pain immediately, and better. And I'm like, good for you. So, but let me say this about nerve entrapments, okay? It is not common at all that I see nerve entrapments in here, okay? And I see like pretty severe, orthopedic conditions, herniated discs all up and down their spine, told they need multiple levels fused. I post these testimonials of these patients that are like, they told me I needed 3 levels fused, and then went to this guy and I opened up his side joints and it was that, and the pain went away, that kind of thing, right? But it is not common for me to see true nerve entrapments, whether it be in the arm. I generally don't see it in the leg, okay? Now, if I do see it, it is in the arm, okay? And what they complain of is it doesn't fit any referred pain pattern of like rotator cuff, referred pain pattern, your supraspinatus or any of that. What they do, I find, is that they tell me like, it just feels like tight in here, and they go like this, and I'm like, what could that be? You pulled your bicep, but or they'll say it's painful in here, tightness and pain, they'll say. And it's this diffuse thing that nobody can usually put a finger on in these patients that I've, and they just kind of are just like, yeah, nobody knows what to tell me, type thing, right? And what I do in those cases, I will test them, okay? I will put them in the position. If somebody truly, I suspect, has nerve entrapments of the arm, I will do the ulnar nerve gliding with them, okay, like that. And then I will do the radial nerve gliding, okay? And then I will do the median nerve gliding like that, okay? And then I will immediately ask the patient to stand up and tell me if you still have that pain in there or tightness or whatever the symptoms were. And or tension that they would call it, right? And if it goes away immediately, boom, I got it, okay? I figured out what it was, okay? It happened the other day. I had a patient come in and she went like this. It just hurts in here. It's painful, but nobody knows what to do with me, that kind of thing, A lot of people think I'm making it up type stories you hear, And I lay them down and I do the median, radial, and ulnar nerve gliding, okay, like that. I go like that and pulsate like that. And then I have them stand up and I ask them, how do you feel? And they're like, oh yeah, it feels freer or it's gone. And I'm like, great, that was it. Boom, I nailed my diagnosis, okay? Now you just do the nerve gliding with them and that frees it up. So the nerve tension is like a king toes, it's described as, and we're just kind of freeing it up through the sheath, okay? So now, years ago, I treated a patient who had herniated discs in her neck, okay? And she also had nerve tension down her arm, okay? And, I'm pushing on her lateral epicondyle. No, it doesn't hurt. Medial epicondyle. No, it doesn't hurt. Testing her strength, everything's normal. And I'm like, I think it's a nerve tension issue. But she had a herniated disc in her neck. And I'm like, look, listen, I'm like, if I do this I'm pretty sure what this is. But if I do this with you, this nerve gliding, and you have a herniated disc in your neck, just like the slump test when you have a herniated disc in your back, I'm going to irritate it. I'm going to irritate your neck, right? But that was this tricky case because it was the only way to diagnose for me the nerve tension, right? That this was a nerve entrapments. And, she agreed to it and her neck was killing her after, which I don't like putting people in pain. I don't like it at all. I don't believe in it, except for frozen shoulders, post-surge. I don't put people in pain. But in this case, I knew what was about to happen, and I warned the patient what could happen, most likely could happen, if I put her into these, nerve gliding situations with these herniated discs in her neck. And of course, her neck felt worse, the pain that was all up in her neck, but she felt freer in her arm, okay? Now, that's a tricky situation because the question is what do you do? It's like taking a patient with a herniated disc in her back and making them do the slump test over and over again, which I see a lot people do. And the purpose of the slump test, again, is if it pisses the back off, check the SI, check to where they're pointing to, but the center of their back or their nerve, they can't extend their leg all the way out, they jump back type thing, then it's a positive test. It's positive because it's irritating where it's herniated in the back or pinched nerve, right? So if you're going to do this with someone and you suspect that it's a true nerve entrapment syndrome and they're going to herniate a disc, know that this is a possibility and you have to warn them. You can't just put someone in pain. I've been doing this physical therapy thing 20 years. And I have been in business 2009. So about 16 years I've been in business, working in my own clinic. And if you don't warn somebody and you put them in pain, if you don't warn them that this could hurt and, like a frozen shoulder, like this is not going to be fun type thing, but, we'll get it there, then you get one pissed off person. This guy hurt me, that kind of thing, right? And then they quit and then the whole thing's counterproductive. So what I realized years ago in business, and when I teach my business students that I teach to open and run these businesses that I have, these non-insurance-based business, cash-based, I tell them that you have to tell them everything that could happen, okay? Because if you do not tell a patient that when you treat a frozen shoulder that it's going to hurt, then they don't understand what's happening, and then they're pissed off at you. And then when they're pissed off at you, then they say, this person hurt me or whatever. But like when you stretch a frozen shoulder, it is what it is. I can get 10 to 12 degrees usually without it with my myofascial method, without hurting the person, just by stimulating other areas of the body. But the person needs to stretch the frozen shoulder. You know what I'm saying? So the same thing, if you're going to put someone in pain, just know that you have to tell them. And I explained it to this particular patient with the nerve entrapment and a herniated disc, what I was about to do and what could happen. And therefore, they're not mad at me and don't quit and say, this guy hurt me, and explain to them exactly what I'm about to do. Now, this is a rarer case, but nevertheless, you have to be conscious of what you're doing to a patient, because if you're doing nerve gliding for the sake of nerve gliding, they got a herniated disc, and you wonder why they're not on your schedule again, is because they probably quit, because I would. I've had a herniated disc in my back, and I couldn't extend my leg out more than 45 degrees because I had so much nerve tension. And I would literally bring my leg up, and I'm like, oh man, if someone did that as a treatment to them, they would never see me again. Okay? So be careful with that. And I generally don't see true nerve entrapments that would require me to mobilize someone's sciatic nerve or put it on stretch. I don't think I've seen it maybe I've never seen it. I don't know. I can't, there it is right there. I literally can't think of a patient. So, and these ones stand out, these anomalies, to me. So I do the same thing all the time, but these anomalies stand out to me and I can't even think of it. So, but I do see it in the upper extremity where they'll go like this. I just feel tight or bound up or pain in there. But if they have a herniated disc, think about what you're doing. You're doing the slump test to them. And if you do the slump test to somebody with a herniated disc in their back, it's going to irritate it. Same thing in the neck. Okay? So that's why I'm not a fan of nerve gliding for the sake of nerve gliding. It's very rare. Maybe in this chronic pain clinic, once a year and a half, maybe I'll see somebody that has it. That's it. I generally don't see it. And most of my patients have threw their hands up in the air type thing. Like, I'm frustrated. This medical system doesn't know what's wrong with me or whatever. And then they come here, and I usually can help, because I, pretty decent at diagnostics, which is what I teach in my membership, to help people get better diagnostically. And I usually can help. So anyways, but it's so rare that, like, why do it unless the person's going to have, symptoms in here, okay? Because if they got a herniated disc, you are going to have one pissed person, or you'll never see them again, and you don't know why they didn't show up for their second appointment, So don't do it unless you need to, is my advice, okay? And explain to them before what could happen and what is happening, anatomically to them, and say, I need to test this, here's the deal, and explain it, just like I explained it to you. Explain it. If I put someone with a herniated disc into a slump test, it's a positive, but if it's bound up, I need to free it up. It's like a hose that kinked, right? But in your case, it's in your arm. Yeah, I believe it's in your arm, but it could irritate your neck. I just need to let you know. But if it frees up your arm, then we know what's wrong with it, okay? So if you explain it to them, then they're not mad at you, I've found. You have to explain things to people. You have to explain things to people and tell them every situation that could happen. I just had a patient that she had a side joint dysfunction. She had to put her dog down, and that's stressful, obviously. And she had the dog for 15 years, and she went into a back spasm from stress. But I had warned her in the beginning that as part of SI rehab, there is a percentage of people, smaller, but a percentage, that go into a back spasm. And if it happens, not a big deal. We just let it calm down, and then we move on. It takes 1 to 3 weeks to one of those things to calm down. And it happened from stress. I asked her, anything stressful in your life happened? I just put my dog down in 15 years. Well, there you go. I had another patient that usually doesn't have to be this dramatic. I mean, just like so many people are stressed in life, right? But it usually doesn't have to be this dramatic. But like, I had another patient that he was doing great in SI rehab, and he gets on the phone with his sister, he said. Well, he comes in limping after spending $30,000 of stem cell injections into his back, and it was his SI joint. And I opened that up, stabilized it. He was doing great. He was actually going to retire from the military because he couldn't walk anymore type thing. And I had this guy, no limp, no nothing, whatever. And then he comes in and I'm like, what happened? And he's like, my back seized up, man. It's like, it's all back. And I'm like, did something stressful happen to you? Did you do anything different? And he's like, well, the other day my sister called and said that she was cutting in and out, and I thought I heard my mom died. And then it cut out. It usually doesn't have to be this dramatic. The mom didn't die. And he said, and the next thing you know, my back locked up and now I can't walk. And I'm like, okay. I'm like, let it calm down. It takes 1 to 3 weeks. Stop doing everything. Okay. And then we'll pick up where we left off. Okay. So anyways, but I warned people about this in the beginning that it could happen. Because if you don't warn them and something happens, they're quitting and they're blaming you for it. Okay. So that's how I teach my business students that, because, in business, your reputation is everything, right? So you don't want people saying this guy hurt me, but maybe it was necessary to put that. It's not fun getting a nerve gliding done to you. You know what I'm saying? So you explain that to them, just explain it. They're cool with it, Anyways, that's that. Peace. Love you all.